Hello everyone, my name is Pranav Chavan, second year MBBS from Dr. Ullas Patil Medical College. Today we are going to learn about histamine. So, what is histamine? Histamine it is classified as an amine autocoid. Autocoid is a substance which is self-healing. The structures in which histamine is found are two: mast cell distributors and non-mast cell distributors. Mast cell distributors contain granules in which histamine is found, and upon stimulus, histamine is released from these granules. Second, non-mast cell distributors, which are brain and placenta. The synthesis of histamine, storage, and release will be seen forward. Synthesis. So, histamine is synthesized from histidine. Histidine is a product which is found in proteinaceous food. Histidine is converted into histamine with the help of the enzyme histidine decarboxylase. The formed histamine is stored in the vesicles. Histamine, being positively charged, is not easily stored in the vesicles. It is complexed with a negatively charged compound, which is heparin. Histamine and heparin complexes are together stored in storage granules in mast cells. So, the stimuli for release of histamine is as follows. The immunoglobulin IgE complex with an antigen of an allergen, when they bind to the receptor which is the Fc epsilon receptor on the mast cell. Fc epsilon receptor on the mast cell, this here you can see there. So the antigen and the IgE antibody, it is an immunoglobulin. When these complexes bind with the Fc epsilon receptor, it triggers a protein kinase pathway. So this protein kinase pathway causes the activation of the protein kinase pathway. This pathway leads to the formation of IP3 and DAG pathway, which helps in the accumulation of calcium. So when calcium is released, or calcium is more in number, it leads to the contraction of the microtubules in the mast cells, which helps in the release of histamine eventually. Helps in the release of histamine and heparin complex eventually. So the released histamine and heparin complexes are exchanged with sodium, since sodium and histamine are both positively charged. So for the sole and free release of histamine, we require an exchange mechanism. So we have here sodium. So sodium is exchanged with histamine, and histamine is released individually. So moving on further, these are the releasing agents of histamine. The IgE mediated, that is antibody mediated release can be food, drugs like penicillin, sulfonamides, venoms like snake and foreign proteins like insulin, etc. And non-human releasers are morphine, opioids, aspirin, vancomycin, and some other ones. Further, receptors. Now the release histamine will act on its receptors. There are mainly 4 receptors for histamine: H1, H2, H3 and H4. We have more clinical significance and action of H1 and H2. H3 and H4 do not have that clinical actions. So all these histamine receptors are G protein coupled receptors. So moving on, we'll learn about some H1 and H2 receptors. H1 receptor is a GQ receptor which always leads to contraction. So contraction of what? Smooth muscles, intestinal muscles, uterine muscles. This is the action of H1 receptor. Yeah, you can always see a vasoconstriction occurs, smooth muscles are contracted, even blood vessels and etc. But it depends where. If it acts on tunica media, it will lead to vasocontraction. But if it will act on the endothelium, so it will help in vasodilation. We'll look how. For vasodilation, the G1 receptors, H1 receptors, which act on vascular endothelium, cause vasodilation by the release of endothelial derived relaxation factor, which is nitric oxide. So it will cause vasodilation. Similarly, H2 receptor has an effect on heart. It produces slight tachycardia and slight inotropism. You can see here positively inotropic, and it causes blood vessels vasodilation since it acts on the endothelium. Moving on, the main action of histamine is histamine receptors are on the glands, since there are quite important functions occurring through the glands. So, with the help of H2 receptors, there is increase in secretion of H plus ions and Cl minus ions, which leads to the gastric acid secretion from the parietal cells. This is all because of H2 receptors, and histamine analogs act on H2 receptors. Second major function is on adrenal medulla. It helps in the release of acetylcholine and non-acetylcholine. Then, now moving forward to histamine, some histamine analogs. Beta histine is a histamine analog which is helped in the treatment of vertigo in Meniere's disease. How does it act in Meniere's disease? It causes vasodilation of the blood vessels by acting on the endothelium, which results in the limitations of the auto manifestations of vertigo. It limits or relieves the symptoms of vertigo. This is a very important function from an histamine analog. Histamine analog. The brand name, the market name for this is Vertin. Moving on to histamine antagonists, antihistaminics as they are called. So there are two classes of histamine antagonists: first generation and second generation. First generation are the ones who are conventionally formed, and second generation are newer generation. We have diphenhydramine, promethazine in first generation, and in second generation we have cetirizine, levocetirizine, rupatidine, lafutidine, etc. We'll learn about distinguish between the first generation and the second generation. First generation drugs show central effects and act and cross the blood-brain barrier, where these effects are not shown by the second generation. Secondly, the first generation antihistaminics cause sedation, and they cannot be used in people with active jobs. People with active jobs have more use of their cortical function, so the first generation drugs are not used. These effects are not shown by the second generation drugs. Thirdly, first generation drugs also show anticholinergic and antiserotonergic effect, which are not seen in the second generation drugs, and they help in the potentiation of benzodiazepine and barbiturates. Now, moving on, we'll learn about some pharmacological actions of antihistaminics. They effectively block contraction of the intestinal and other smooth muscles. They lower the BP fall antagonized. The constriction of large vessels is also antagonized. An anti-allergic action, that is manifestation of type 1 hypersensitivity, is also suppressed. Second generation antihistaminics will learn the advantages, some points over first generation. They have high affinity for H1, and absence of CNS present property, as we know, no sedative property. They have no psychomotor impairment, no subjective effect, no sleep induction, and they do not potentiate benzodiazepine and alcohol, but the first generation ones do potentiate BZD and barbiturates, since they have sedative function, and first generation ones also have sedative functions. Secondly, we'll move forward to this individual antihistaminic, that is cetirizine. Cetirizine, or nowadays it is used as levocetirizine. It is a high affinity for H1 receptor, but it does not, as it is a second generation one, it does not cross the blood-brain barrier. It is not metabolized on action, and it does not have any cardiac activity. Other than anti-allergic action, it inhibits histamine and the cytotoxic material release from platelets and eosinophils. Then its uses as in upper respiratory allergies, pollinosis, urticaria, atopic dermatitis, and seasonal asthma. Now we'll learn something about some MCQs. Which of the following statements about histamine is correct? Here, histamine is stored in peripheral nerve endings, released from mast cells, is a vasoconstrictor, is an essential amino acid. The answer here is option B. Histamine is released from mast cells following an allergic change.